Hello everyone, welcome back to my YouTube channel. Today we'll study about drugs acting on nervous system. Under this topic we'll study about the drugs which are acting and the drugs which are used to treat the neurological disorders. So those are analgesics and anesthetics. So analgesics, under analgesics we are going to study about non-steroidal anti-inflammatory drugs. These drugs are also called as NSAIDs and opioids and non-opioids. And under anesthetics, sedatives and hypnotics, we'll study about tranquilizers, general and local anesthetics. These general and local anesthetics, those are gases, oxygen, nitrous oxide and carbon dioxide. And here we'll study about the composition, action, indication, contraindication, dosage, routes of administration, drug interaction, side effects and adverse effect of these drugs, toxicity and rule of nurse of all these drugs. And also we'll study about the cholinergics and anticholinergics. And under this we'll study about the muscle relaxants, tranquilizers, and also we'll study antipsychotics, antidepressants, anticonvulsants, adrenergic, non-adrenergic drugs, mood stabilizers, acetylcholine and central nervous system stimulants. So under the nervous system we are going to study about all these drugs which are used for the treatment of the neurological disorders, and next we will see the explanation about these drugs. Under that we will study about analgesics and anesthetics. So here analgesics. Before studying about the drugs which are comes under the analgesics, we should know the meaning of analgesics. So that is, the word analgesia is nothing but an pain, and the meaning of ana is nothing but an absence. Here the meaning of analgesics are the drugs which are used to treat, to reduce the pain. So this is the meaning. And here the analgesics are again divided into two types. Those are opioid analgesics and non-opioid analgesics. Here first we'll see the meaning of opioid analgesics. Drugs which cause sedation and are used for the moderate to severe type of pain. Means these drugs causes the sedation. Sedation is nothing but a sleepiness. Sleepiness or the calmness. When you administer the opioid analgesics, the person may feel the sleepiness or in a calmness, and are used for moderate to severe pains. Means these drugs are used to treat the moderate and in a severe type of the pain. Example, morphine. So this is the meaning of opioid analgesics. And next we'll see the non-opioid analgesics. Non-opioid analgesics means the drugs which don't cause the sedation. Means these drugs don't cause the sedation. Means when we administer the non-opioid analgesics, these drugs should not cause, means should not increases the sleepiness or the calmness in the patients, and are used for mild to moderate type of pain. Example, NSAIDs means non-steroidal anti-inflammatory drugs. So first we'll see the non-steroidal anti-inflammatory drugs, NSAIDs. Non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. These drugs are also used as an analgesics as well as antipyretics, and also used as an anti-inflammatory drugs, and also used as anti-inflammatory drugs. Means analgesics, as now you know the meaning of analgesics. Means the drugs which are used to reduce the pain, and antipyretics are nothing but the drugs which are used to reduce the fever or in a body temperature. and anti-inflammatory. Anti is nothing but an against. Against means these drugs are used to treat the inflammatory conditions in the body. And now we'll see the mechanism of action of non-steroidal anti-inflammatory drugs. Mechanism of action means when we administer these drugs, how it is going to work in a body. So here they inhibit prostaglandin formation in inflamed tissue by two actions. They inhibit prostaglandin formation in inflamed tissue by two actions. Before studying these two actions, first we should know the meaning of prostaglandins. Prostaglandins, these are the lipids, are the hormones which causes the tissue damage. These are the lipids are hormones which causes tissue damage. So here the prostaglandins are responsible for the tissue damage. So when inhibition means, the meaning of inhibition is nothing but prevent. Here the mechanism of action of these NSAID is going on two processes, that is inhibiting the stimulation of the pain receptors. Inhibiting is nothing but prevention. Prevention of stimulation. Stimulation is nothing but activation of pain receptors, means the receptors which are activating the pain. Means what it does, the first mechanism of action is these drugs are preventing the stimulation of pain receptors. Here the pain receptors, it may be these pain receptors, the signals may reach to the nerve endings. Means here the damage of the nerve endings may leads to the pain. When the damage of the nerve endings occurs, the message reaches to the brain. Once the message reaches to the brain replies the pain. And the second mechanism of action of these NSAIDs is inhibit the prostaglandin synthesis with central nervous system and stimulating the peripheral vasodilation. Means inhibit the prostaglandin synthesis with CNS. It inhibits the prostaglandin synthesis with CNS and activates the peripheral vasodilation. Once the stimulation of peripheral vasodilation occurs, the body is going to release endorphins. Once the endorphins are releases, it relieves the pain. So this is the main mechanism of action of non-steroidal anti-inflammatory drugs. Now we'll see some of the examples for NSAIDs. Here drugs, salicylates, aspirin. Dosages, it is administered 75 to 325 mg orally. And paracetamol, the dosage is 500 to 1000 mg orally and not exceeds 4 grams per day. Not exceeds 4 grams per day. When it exceeds more than 4 grams, it may lead to the toxicity or an acute paracetamol poisoning. Toxicity is nothing but it releases the poison, and also it may lead to the acute paracetamol poisoning. And another example is diclofenac sodium. The dosage is 50 to 100 mg per day. And aceclofenac, the dosage is 100 to 200 mg per day. Ibuprofen, 200 to 1600 mg per day. And ketoprofen, 75 to 300 mg per day. And mefenamic acid, 500 to 500 mg orally for every 8 hours. Means this drug is administered 500 mg per day every 8 hours. Means it is tedious, 3 times in a day. And Next drug is naproxen. Naproxen, it is administered, the dosage is 250 to 1000 mg daily. And next is nimesulide. Nimesulide, this is administered, the dosage of nimesulide is 100 to 200 mg per day. And next drug is indomethacin. Indomethacin, the dosage of this drug is 25 to 75 mg per day orally. Indomethacin 25 to 75 mg per day orally. And ketorolac 30 to 120 mg per day. And piroxicam 20 mg orally per day. So these are the some of the examples for NSAIDs. Next we'll see the indications, contraindications, adverse effect and nurse's responsibilities. Indication is nothing but in which condition we should administer or we should use the drugs. So here, to reduce the pain, means the drugs which are used to treat the pain, those are analgesics. Analgesics are used to reduce the pain. And also arthritis. Arthritis is nothing but an inflammation of the joints. Inflammation of the joints. And in pyrexia. Pyrexia is nothing but in the treatment of fever. Means these drugs are used in the treatment or to reduce the fever. And next, these drugs are used for the prevention of transient ischemic attack and myocardial infarctions. Those are aspirin. Aspirin is mainly used to prevent transient ischemic attack and myocardial infarctions. And also these drugs are used for the treatment of dysmenorrhea. Dysmenorrhea is nothing but painful menstruations. Painful menstruations. So these are the some of the indications of NSAIDs. Those are pain. These drugs are used for the treatment of pain, arthritis, in pyrexia, prevention of transient ischemic attack and myocardial infarction and dysmenorrhea. Now we'll see the contraindications, means in which condition we should not administer the drugs. Means if we administer these drugs, it is an unsafe for. And here the some of the conditions are in pregnancy. In pregnancy we should not administer prior taking the opinion from the gynecologist or the physicians, because here when we administer a drug, it is going to affect on the placenta. Means when you administer the NSAIDs, it is going to affect on the placenta. It affects on the placenta, it may causes the placental insufficiency. Placental insufficiency means it is nothing but decreased blood flow to the placenta. Decreased blood flow to the placenta. If once the blood flow decreases to the placenta, the baby or the fetus will not get an adequate blood from this placenta. So once the reduced blood supply to the baby, it may lead miscarriage or the abortion or the premature death or the premature death. So while administering the NSAID, it is better to take the opinion from the gynecologist as well as the physicians. So the next conditions is aspirin hypersensitivity, means when the patient is having reactions towards the aspirin, we should not administer the drug, that is aspirin. When the patient is having reaction towards the aspirin, we should not administer the drug. Hypersensitivity is nothing but allergy towards the aspirin. And next is bleeding disorders. During bleeding disorders, we should not administer the aspirin, because the aspirin is again causes blood thinning. Blood thinning means it makes the blood thinner. Means already the patient is having the bleeding disorder. Again, if again you administer the aspirin, he may go for the hemorrhagia. He may go for the hemorrhagia or the severe bleeding. So it may leads to the shock. If the patients once may go to the hemorrhage, it may leads to the shock. And next, the patients who are having the asthma. Asthma, when the patient is having the asthmatic conditions, if you administer these drugs, it may causes the bronchospasm. Bronchospasm. Bronchospasm is nothing but a narrowing or the spasm of the bronchioles. Means once the bronchial spasm occurs, he may be having the difficulty in breathing. So this is contraindicated during pregnancy, aspirin hypersensitivity, bleeding disorder, asthma, and lastly is children's. Means whenever you are administering drugs to the children, you should take opinion from the pediatricians. Next we'll see the adverse effect of NSAIDs. Here when you administer the NSAIDs, it may causes the GI pain. GI pain is nothing but a gastrointestinal pain because of the increased HCl secretions may leads to the GI pains, and also it may leads to the stomach upset and peptic ulcers. Means presence of ulcers in the stomach, that is a peptic ulcer. Means the ulcers are going to form when you use the excessive amount of the non-steroidal anti-inflammatory drugs. They may cause the peptic ulcers or the stomach ulcers, and also the person may go for excessive diarrheal conditions or the diarrheal disorders. Why? Because of when you administer the excessive amount of the NSAIDs, it may reduces mucus secretions in intestine or the GI system. It may causes the diarrhea and nausea and vomiting. These are more common for any drugs. And tinnitus. Tinnitus is an inflammation of middle ear. Inflammation of middle ear. If the inflammation of middle ear occurs, the patient may hear the ringing sound. So this is an tinnitus. And next, headache. Laryngeal edema means edema, the swelling of the larynx, and because of the hypersensitivity reactions, the person may get rashes and bronchospasm and shock. If you administer these drugs during the bleeding disorders, because of the excessive fluid loss or because of the excessive bleeding, the person may go for the shock. And also hepatic and renal failure, because the metabolism is mainly occurring in liver. Metabolism is mainly occurring in a liver. Because of when you administer the excessive amount of the NSAIDs, it may causes the hepatic and renal failure. Renal failure is nothing but kidney failure, because the excretion occurs in a kidney. Next we'll see the nurse's responsibilities. Here, before and after administrations of any drugs, this is very important to notify some of the indications and the contraindications are the effects and the side effects in the patients. So those are: instruct the patient to take oral NSAIDs with food to minimize the irritations. What she should do as a nurse, she should instruct the patient to take oral NSAIDs with food. Why? To minimize the irritations. To minimize irritation. Which irritation? Gastrointestinal irritations. And the next responsibility is obtain a complete health history. Obtain a complete health history regarding the drug hypersensitivity, or whether the patient is having any medical conditions like asthma and hepatic disorders, or ask the female patients whether she is having any obstetric history or not. And next, administer the liquid aspirin immediately after mixing because it breaks down rapidly. Means administer the liquid aspirin immediately when after mixing. Why? Because it breaks down rapidly. After the mixing of the liquid aspirin, we should administer as much as possible, early as much as possible. Why? Because it breaks down its concentrations. Once a drug is lost its concentration, it cannot work. Means there is no any use of administrations. And next we'll see instruct the patient to report. Means instruct the patient to report bleeding, heartburn, abdomen pain, urination, and anorexia. Anorexia is nothing but less intake of food or loss of appetite. Why? Because after administrations of the any drugs, the patient may go for the bleeding, heartburn, that is nausea, vomiting. Because of the GI irritation, it may increases, and also abdominal discomfort or abdominal pain and urination. So especially in the urination, sometimes the patient may having the hematuria or the painful micturations or the burning micturations. You should ask the complete history about the patients after the administrations. And also sometimes the patient may having anorexia or the less intake of the food. And the next responsibility is monitor hypersensitivity reactions. Why we should monitor the hypersensitivity reactions? After administration of the any drugs, the patient may lead for the allergy. That is a drug allergy. To avoid these allergies, we should have a close monitoring of the patients. So, this is a brief introduction about the non-steroidal anti-inflammatory drugs.